So a 60-year-old man is diagnosed with cardiovascular disease. A 45-year-old man has type 2 diabetes. A 30-year-old person, a 30-year-old woman cannot find work, whereas a 25-year-old person has trouble getting higher wages compared to their peers. A 15-year-old girl drops out of school, and a 5-year-old child is stunted. What do all these people with different health, educational, and economic conditions over their lives in different parts of the planet, from different races, religious backgrounds, and genders have in common? It's not genes, though genes have a role to play in it. In fact, the latest research from biological and economic sciences is showing that both health and wealth over our lives, especially in poor countries, but also in rich countries, across different backgrounds, is shaped by the fetal environment. That's right, even before we are born, the environment can shape the health and wealth we have. This wasn't always the case. There was a time when epidemiologists thought of the fetus as a perfect parasite. That if the mother is malnourished, that doesn't necessarily mean that the fetus is going to be malnourished. The placenta was thought of as a perfect filter, protecting the fetus. In the 1960s, for example, like women were openly encouraged to smoke during pregnancy. And half of them did in the US. We actually have vintage ads of that. And all of that was challenged, particularly through the writings of David Barker. David Barker was an epidemiologist and a physician who argued that inadequate nutrition in utero can program the fetus so that it can have metabolic characteristics which are predictive of disease later in life. There is this idea that our fetal environment can actually lead to these adaptations which prioritize survival over growth. And they themselves manifest themselves in lower birth weights, for example, of the kids. But that's not the only measure. In fact, many of these factors are latent. You don't even see them in the kid when they're born. And they just show up after 40, 50 years at times. And they found this, that for example, initially there were correlations between, let's say, low birth weight and obesity and diabetes and even cardiovascular disease, which really caused a big stir in the scientific communities. It was treated with skepticism initially. Now we have findings from animal models, for example, which, for example, some studies have experimented and shown that rats which are pregnant are exposed to malnourishment, give birth to offspring who are smaller in size. They're less likely to live longer. They have symptoms of heart disease, and they may even have smaller brains. Barker seems to be vindicated. But that's this animal studies, right? So you might be thinking, how does it apply to us? Epidemiologists have been particularly interested in the use of the natural experiments. So you can't really randomize malnourishment to pregnant women and wait until 50 years. That wouldn't be very ethical or even practical. So these natural experiments are basically you observe the world and you look for accidental events which randomly affect some people and don't to others. And so you can hope to find very similar people in that sense. So for example, the Dutch famine was one of those cases. There's very good data in Netherlands. There was very adequate nutrition before, and suddenly in October 1944, for example, the Nazis had occupied northwest Netherlands and cut off shipments of food. So that by April and May 1945, the food rations were so restrictive that the caloric intake fell all the way to 500 calories. And many of these affectees were pregnant women. Studies have found that if you follow the offspring later in their lives, you find them to be, if you're exposed to famine in utero, you're more likely to be obese later in life. And they find symptoms of diabetes and even schizophrenia at age 50 is predictive of that. These are health effects, and one of the mechanisms and like one of the fields which has really taken some inspiration from some of these studies is economics. In economics, understanding the origins of wealth has been a topic of study for a long time. And perhaps one opinion is that wealth is fundamentally shaped by labor productivity, which in turn depends on the skill of the workers. And what this research is saying, basically, the way to connect this and what economists are doing these days, and they're finding some great evidence now, is that the fetal environment can affect these skills in multitude of ways. One is, of course, if it affects adult health, and if you're sick or disabled and you may not be able to work, so that's a direct effect. But indirectly, perhaps, specifically when you talk about IQ, there are studies which show that prenatal nutrition, for example, can fundamentally affect your cognition during school-going ages. And even your IQ could be affected. Furthermore, studies even show that your personality traits, like self-discipline, grit, persistence, big 5 personality traits, actually are shaped by early life environment, including the fetal period. And all these skills between health, cognition, and personality traits can be thought of perhaps the drivers of skills in modern economies, and which enhance the productivity and actually shape wealth of individuals and civilizations. One piece of evidence, recently, for example, economists have been following up on the famine studies. They've also been interested in looking at the economic effects of famines. And the Chinese famine has attracted some interest. Up to 30 million people were killed in the Great Chinese Famine of 1959 to 61. And if you look at the survivors, and if you want to look at people who were prenatally exposed to these famines and not, what we find is that the adults now who actually have kind of grown up, they're less they have fewer years of schooling, they're more illiterate, they're less likely to work irrespective of gender, and they have fewer assets, and even they're less likely to get married. And if they do get married, they get married to people who are less educated than them at times, which has further implications for their families in next generations. Now you might be thinking, okay, famines are interesting case studies to study, but they're extreme events. You probably think famines are extreme, I might expect something to happen. So what about things which you and me do on a day-to-day basis? Day-to-day activities. If we can find that even mild events during pregnancy can have long-term effects, then that would be transformational. For instance, let's consider skipping meals or even fasting, for example. There are some studies which show that 1 in 3 pregnant women in the US skip breakfast. And outside this, perhaps an interesting case study is fasting during Ramadan by Muslim women. So 50 to 70% of pregnant women fast for at least 1 day or more of Ramadan in diverse circumstances. That's the data we have so far. And since a pregnancy lasts about 9 months on average, in any given year, 3 or 4 pregnancies will overlap with Ramadan. And Ramadan basically is not correlated with season, so it moves back 11 days every year. It's a lunar calendar, so it's a very nice natural experiment in that sense, especially if you look at long enough cohorts. It is as good as random. And so what you could do is, before I explain the results, something which one must understand, Islamic law exempts women from fasting. So it's not at the law, but women still choose to do so. And scientifically, one of the things which is interesting here is that it's not that the total caloric intake is going down. because people eat meals in the morning and in the evening. So this is just the disruption, the skipping the meals during the daylight hours, and the water, which is where the natural experiment is like coming in. So if something as mild as that relative to a famine can have long-term effects, then that would be something. Just completely opens our minds and what are the subtle ways in which the fetal environment can have an effect. And indeed, when you see, for example, some cases you can even compare biological siblings, share the same mother, same genes, same environment. One sibling was just prenatally exposed to Ramadan and the other one was not. And what you find is that the kids, when they grow up, are more likely to have heart disease and symptoms of type 2 diabetes. In the US, in Michigan, they found some evidence of lower birth rate. In Indonesia, I did some work on this myself, and I found that like the kids, when they were 6 to about 7 to 15, had lower test scores. 15 to 65-year-olds worked fewer hours, particularly affecting women's labor supply. And there was a structural change in the economies where people are moving away from more skill-based jobs to more informal jobs. They were more likely to be self-employed and less likely to work in wage sectors. Other than these findings of famines and mild events, perhaps, so economists have been interested in seeing what are the implications of this work. People have estimated the benefit-cost ratios of investing in stunting reduction. What this graph is showing you is showing you the 14 countries with high risk of malnourishment, which include South Asian countries, Middle Eastern countries, and Sub-Saharan African countries. And what you're seeing here is that, for example, if you look at the chart for India, it shows that $1 invested in stunting reduction gives you $34 back. That is how high the return is. And the smallest number on this thing goes to the DRC, where you get $3.8 back. So everything in these 14 high-risk countries is greater than 1, which means it's a fantastic investment. I would like to challenge you to beat this investment. What kind of financial investment can give you this kind of returns? If you look at the US stock market, for example, it's been less than 10%, 6-7% historically, for example. I mean, you don't get very high returns compared to some of these nutritional investments. In fact, so this is a stylized graph, which is the source is James Heckman, Nobel laureate in economics, and I think it kind of summarizes what we think right now is happening. That the y-axis shows the economic returns to investing in human beings, and the x-axis shows the time in the life when we invest. So this is the prenatal period, then you have if you invest in children who are 0 to 3, or 4 to 5, or school, or post-school. And what we find is that the downward sloping shape of this curve suggests that the highest returns come when you invest in the fetal period, in the prenatal programs. And as the children are born and they grow, the returns are positive, still it's valuable and you should be doing it, but they're less effective as children age. And you reach an interesting point where if you invest in, let's say, economic programs like job training to enhance the labor productivity, you might get lower economic returns than investing, let's say, in iodine during pregnancy, which might even have much greater returns. So these are drastically helping us rethink about how we think about what is an economic investment. Some of you might be thinking, we know children matter. Who doesn't know? I mean, policymakers should know about it, right? Two arguments at least. First, the fact that the studies are showed, for example, and there are many others like this, are showing that prenatal exposure, even to mild events, can have long-term effects, suggests that policies are not working. Because if they were, they should have protected those children, and these effects shouldn't be found. In principle, if the policies are working, and even if there is an adverse effect, the policy should buffer the fetus against those things so that we shouldn't be finding long-term effects. The fact that we are, even in developing in rich countries at times, suggests that policies are not working. Second evidence is that if you look at public expenditure data in the US, for example, there are some studies which suggest that we spend almost 10 times more on the care for like elderly, for example, compared to children who are less than 8. This is some data from Latin America. And what we find here is that the red bar chart shows how much we're spending on children who are 6 to 12, and the blue one shows how much we're spending on 0 to 5-year-olds. And what we find here is that across the board, first of all, like governments are spending less than 2.5% of their GDPs on any health or educational or social program related to like children who are less than 12. And when you look at 0 to 5, there is a disproportionate, the priorities are completely opposite. They're spending far less on 0 to 5-year-old compared to 6 to 12. So no, by their actions, the governments don't seem to know this, if you think that they know. And what about parents and people like us? Right? I think one of the implications here is that, for example, we think about that if we want a smarter kid, parents think we spend a lot of time with homeworks, helping their kids, let's say if you're in school, that is the best way to make them smarter. What this is suggesting is we should do that, but if you have a limited amount of time over your life and you're thinking, you might want to start much earlier if you want a smarter kid. Right? It's not just when they go to school and then you're spending all this money trying to see this thing. It's maybe too late. The IQ is, for example, some studies suggest is already developed mostly before age 10. So if you're really concerned about having smart and wealthy children, start early and think about those. Men should care for their partners, and like women, particularly in like pregnancy, and like vice versa. People should. One of the implications, and this would be, I think, like the takeaway, is that there was a time when epidemiologists thought of the fetus as a perfect parasite. I think the latest research, what this is suggesting, is that whether it's policymakers or whether it's us, like at the family level, at the community level, or at the global level, we need to foster and create environments which prioritize investments in children and in women much earlier in their lives, and so that we can have a healthier, wiser, and wealthier future. Thank you.